The one on the bed, could you not sit down properly? Please. We're having lectures. Please.
All right.
Please. With all due respect. Kindly sit down. You're having lectures, okay? Please.
I'm sorry, I'm not feeling too well.
That's fine. That's fine. But at least position yourself, because these videos will go, it's being recorded, so you'll be captured. You understand?
I can
So at
put
least
off my camera for you.
I need a video of you briefly, and then you can go off the video. So if you can sit down properly, and then you need to be captured, and then I'm going to take it off just briefly, okay? Just briefly. All right. So we have Ali, Osama, Selena, and then what else do we have? That's fine. Okay. We have Bola who have just joined. Bola, have you written your name on the message group?
Yes, I've done that on the chat earlier, Davidson.
You have done that. Okay, that's fine. So we're good to go then. Yeah. So yeah, so good morning once again. Today we'll be looking to sort of ascertain unit 1, but the learning outcome 3, which underscores the clear understanding of the different areas of specialization within the health and social care. And it has 3 components, or it has 2 components. First, you would have to analyze the different specialized area within the health and social care. And then also we should be able to dive into how to describe a range of health and social care professions. And then the last bit is look into how to outline how the access to professions are regulated. So we spoke last week about various professions or regulated or bodies that finds itself within the health and social care. One of it we spoke was the CQCs, and then we were able to identify some regulatory bodies that seems to regulate professionals within. We spoke at the GMC, the General Medical Council. We spoke at the NMC, which is the National Midwifery Council, that regulates nurses. And we spoke about the GBC, GMC. I need people to unmute themselves. Can we unmute ourselves, please? Those of us who have just joined, could we write our full names on the message box?
She would just scream, leave me alone. She's not just compliant.
Could you write Elizabeth, Sabina, could you mute yourself? We can't be talking whilst lectures are going on. I'm sorry, please. Now, then we spoke about the various professions that are regulated within the health. So one of the key ones we spoke about was the CQC, and we were able to identify that CQCs are the main regulatory organization or inspectory organization that seeks to regulate all healthcare companies or organizations, from the NHS to any company, whether supported living organization, whether an Ofsted organizations, any other organizations, they need to have a CQC inspected and then they need to be approved by the CQC before they could operate. So the CQC was the mother organizations that any healthcare should know and to have clear understanding of their duties and clear understanding of their responsibilities. I did mention that the CQC have the right to recommend a company to be shut down, but it has a right to a company to be shut down. And so CQC plays a major role. Then we spoke about what other things that they do. They attend your organizations and they are able to recommend that having assess the inspection and what it does, then they could classify you as an excellent organization or a poor organization. And for those of you who already work within the healthcare, you will then agree with me that anytime there's going to be a CQC inspection, then you realize that your managers or your what do you call it? Your supervisors are very keen and very, very directive in terms of how you would primarily look into the various areas that needs improving within your organization. Okay. Then we spoke about, and I'm doing a recap about last week. Then we spoke about various professionals within the healthcare industry and the various regulatory bodies that regulates them. And so I did mention the GMC, which regulates the medical council, that regulates doctors, consultants, all those specialties within the health and social care. Then we also touch base on opticians. We, that are regulated body that regulates the opticians. We spoke about pharmacists, regulatory bodies that sort of regulate pharmacists, and many other professionals that find themselves within the health and social care, and you are not your own because you can't do things on your own. You are regulated. In other words, there are tenets, there are pros and cons that any professional would have to adhere to or would have to sort of apply or comply to, so you become a good professional who is doing things right. One, to safeguard yourself as a carer or as a nurse or a doctor, and two, to ensure that you don't do anything that will lead to prosecution or that will lead to prison, and three, that you don't do things that may present you as unfit to practice. When we say unfit to practice person, what we mean is that your PIN that may be given to you as a nurse may have what it takes to be taken up, because the NMC would have the right and the powers to investigate any report that will be made against you. And for that matter, they have the right to withdraw your PIN from you. You can imagine if you spend 3 years or 4 years in a nursing school to be able to obtain a PIN, and within 1 month or so, that PIN is taken from us. We don't say these things and forgetting about healthcare and professionals. And for that matter, doing the level 3 qualification presents you to be what we call a senior carer within your jurisdictions or jurisprudence. Okay. And so, and healthcare for that matter, though healthcarers may not have necessarily a regulatory body that regulates them. However, we are required by law that you join a union, okay? So any carer or any professional should be able to join a union. One of those unions, we have the TUC, we have Unison, and various, all the Royal Society of Nurses. There are various unions that you join, and these unions are able to protect you against any allegations or any issues. One of the common issues that healthcarers go through is the allegation of sleeping on duty. And so it is important that you ensure that you present yourself and ensure that you don't do anything that will go contrary to the pros and cons which is required, that when you sleep on duty, it is a big issue. And so even though the health carriers do not have a regulatory organization that regulates them, but one of those organizations that cut across when it comes to healthcare is what we call the DBS. Okay, now the DBS are the only organization that have the right to sort of deal with health carriers beyond their companies that they work with. In other words, if a company finds you palpable or finds you wanting or finds you unfit for practice, because the company themselves cannot do anything against you as a carer, all they could do is probably terminate your contract. And they would have to follow due processes in doing that. And listening to you. So you'll be invited to a disciplinary meeting. Should they found that somebody has made allegation against you or sleeping on duty, and or of done anything that raises safeguarding concerns or related safeguarding issues, one of the things your organization will do is to give you an opportunity to defend yourself, what we call the right to defend yourself. So you'll be invited for a disciplinary meeting, and then they will have to listen to your side of the story and juxtapose it or look into it and ensure that it has some kind of truth as compared to what has come before them. And if there are evidence of you sleeping on duty and videos of it, they will listen to you, and they feel that your case is right, then probably may give you a warning. But if they tell is a big issue, it's a big safeguarding issue. For instance, you slept on duty and the person you are taking care of fell down and died, or fell down and had some fractures in their bodies. That is a serious issue. That is a serious issue. And for that matter, it must be investigated. And once they investigate and they feel that there's a merit or there is a case that needs further or that raises concerns, then they will further refer you to the DBS. So this is what becomes an issue. Hello, could we mute ourselves? Who is speaking? Hello, who is speaking, please? Sabina, could you unmute yourself, please? So should you find yourself, when you be referred to DBS, and should you find yourself capable, the DBS have the right to either give you a warning or to send you a letter of what we call minded to bar. Minded to bar, okay? What it means that the DBS has an intention of barring you for you not to be able to work as a carer anymore. And that's a very big issue, because everything in this country is about DBS. Everything in this country is about DBS. Everything from cleaning to security to everything, either a standard DBS or either an enhanced DBS. And therefore, it is important that you ensure that you comply with what you are meant to do in your workplaces and within your organization. If the DBS decides to ban you, and when they ban you indefinitely, it means that you cannot work as a carer for over 10 years. You cannot work as a carer for 10 years. And if you do anything illegally, if you decide to go and apply for a job that involves a care area or anything that involves DBS and they find out, you go to prison. Okay. So when we talk about specialty within the health and social care, there are various profiles. So we can look into some of it, which are more consultory role. You know, we've had a discussion about the NHS and the various functions with the primary care, secondary care. But then we also can look into the pediatrics, the genetics, maternity, mental health, social worker. And then in terms of the consultants, when we say consultants, they are the higher professional within the doctorate environment. You know, doctors, we have junior doctors, we have senior doctors, but we also have consultants. Those are specialized area. They are the ones that sort of make decisions on your health, whether you have to be given surgery or not. So we have neurologists, we have respiratory medicine, we have the powdered intensive care, the metabolic medicines, but that's for ourselves in emergency medicine, clinical, pharmacology, analogy. And so these are a few area specialties within the health and social care. Now, the geriatrics works in a variety of settings. They find themselves in A&E, medical assessment units, acute care, rehabilitation wards, and care homes and hospices, okay? They provide patient-centered, compassionate, holistic approach and work within the GPs and all the hospital doctors, social workers and families and carers, okay? And they do what we call diagnosis and management of acute illness, as well as chronic disease, disability, and fraternity as part of those jobs. One of those common procedures or interventions will be performing a comprehensive assessment of an older person, including a mood and cognition, gait and nutrition and fitness surgery, including physical examinations where necessary, assessing to patient suitability and continuing the care. So basically, this will a geriatric medicine is the branch of medicine that's concerned with all aspects of health and illness in older adults. It's therefore the largest medical specialty, and this is what you need to know when it talks about geriatricians, who are geriatricians. This is what they do, okay? And we have to look into some kind of a bit of maternity, The maternity support worker is the front line of a family's journey throughout pregnancy, which we know already, childbirth, and the first few days of work. What are their role then? What do they do as maternity support workers? Okay, if you go into the hospital, you see support workers working with the nurses within the hospitals when you are pregnant or when you are about to deliver. What do? They help to take care of mothers and babies. They make routines, observations, okay, that tend to look into the temperature and pulse, blood pressure, and breathing. This is what we call observations. When we say observations, the routines that doctors, nurses, and healthcare do is in terms of taking your temperature, your pulse rate, ensuring that your breathing speed is the same with you and the child. They are able to test all those. So those are some of the things that maternity support workers do. So if you're a healthcare studying level 3, you can either go into the branch of maternity support workers or any other support worker. They update records. Yeah, they update records. Of course, they record all the information that they've gathered about you. They're taking blood samples. Not everybody is trained to take blood samples, but some are trained to take blood samples. It's a different area that you need to be trained on. You cannot just take blood samples when you have not been trained to do that. And if you do anything that you have not been trained for, it is illegal, okay? And preparing equipment and promoting breastfeeding, okay? Report problems to registered midwife or nurse. These support workers can work either in the community or the postnatal wards or maternity theaters, delivery suites, or midwifery-led units, okay? Then we could look into mental health. When people live in mental health, describe the long impact that creates mental health care had their recovery and their lives. There are many roles within the mental and professions. We can have psychiatry, we can have occupational therapy. Okay, we could talk about the pharmacists, we could talk about the nursing associates. Nursing associates are just like support workers, but then they are assistants to nurses. Okay, they are able to do the blood samples, are able to do many things just like nurses do. Probably the only thing they cannot do is able to give control medications and all that. Okay, and prison nurses, mental health nurses, and drama therapists. Mental health nursing offers high quality and meaningful clinical experiences from nursing associates who support patient care and improve experiences on patients and carers through to registered nurses and those in advanced practice. Mental health nurses have a wide range of skills that are vitally important to the running of mental health services. For those of you who intend to become mental health nurses, this is what you do, okay? You are meant to give some sort of care for people who find themselves in mental health disability or mental health syndromes, okay? And you are there to sort of help them in those and ensure that they have gotten what it takes in terms of the medication, or ensure that there are various observations that have been given, you adhere to. And when people need what we call 2-to-1 care, you are there to provide. Some people may need even 4 people because their mental health ailments may be very severe, and therefore they need about 4 people that need to be with them to take care of them, okay? So that when they become aggressive and all that, there are people available to sort of look into it, okay? Now, we could also look into what we call social workers and what they also do. Now, we all know that social workers make a very huge difference to individuals and families by helping them live their life more successfully. We can also say that they work with families and others around them and with different client group, including the elderly. And so basically, we all know that social workers play a major role, okay? And they are there to work with families and to ensure that their well-being and their welfare and needs are met, okay? So they work with the elderly, they work with all kinds of people, from refugees, asylum seekers, families at risk of breaking down, children who need to live apart from their families, foster carers, adopted children who are at risk of abuse, of neglect, and caring. So all these falls under social care, their duty. So in the UK, every family have a social worker. Every family has a social worker. It's very important. So this was social. So those of you who intend to become social workers, this is what they do. They are there to ensure that there isn't any risk attached to any family, and to make sure that whatever needs that they need to be addressed, the social workers would have to assess that and report to the various local authorities, and to make sure that there are no further issue that always concerns, whether safeguarding or for the children, especially if you live with children. The children's welfare are very important to social workers. That's why they have to come in every now and then to ensure that there's children are sleeping well, there's no issues of needs, there are no issues of monetary issues, financial issues, eating issues. Social workers are there, okay? So some of these professions within the health and social care are doctor, nurses, specialists, health and social care, and the role of a doctor, okay? Now, I did mention that doctors' role is what we call a primary care. It's one of the primary cares, because the NHS or healthcare are divided into primary care, secondary care, and tertiary care. So a doctor's role is a primary care. Now, what does a doctor do? We all know doctors prescribe and administer treatment. They provide follow-up care patients that refer them to providers and interpret their laboratory results. They maintain knowledge, skills, and performance. They treat patients as individuals and respect their dignity. They work in partnership with patients. They are honest and open and act within integrity, of course. They never discriminate unfairly against patients or colleagues. They never abuse patients' trust and public trust in profession. Okay, they take prompt action of what they think that patient safety, dignity, comfort is being compromised. They protect and promote the health of patients and public. This is what doctors do. Okay, so a doctor is the kind of person that you need to trust. Why? Because we open up and tell them private things about us in terms of our ailment. Why? Because if you don't do that, then the doctor is not able to understand your real situation to be able to match the necessary treatment that you need to be giving onto you, or necessary medication that they need onto you, because the doctor then can sort of refer you to scans and to be able to operate your situation, whether you have a cancer, whether you have certain ailments and all that. And therefore, you have to gain a doctor's strike. You don't hide nothing from a doctor. Very important, okay? And the role of a nurse is also forms itself under the primary care. The nurse is professional within the health industry, focus on the care of individuals, families, communities, so they may attain or maintain or recover optimal health and quality of life. Okay, so nurses, what do they do? Okay, what do they do? They record medical history and symptoms. Very, very important. They collaborate with teams to plan a patient care. Now, nurses would also work hand in hand with doctors, because they are the first point of call apart from the support worker. Support worker sees you, but the nurses are the next stage of persons that would have to see you and sort of register your symptoms and all that. And those recommendations and those information that the doctor would have to look at, having checked your observations, your pulse, your blood rates, and all that, the doctor then can tell which direction to keep you, the kind of ailment that you are facing, and the necessary medication that need to be given onto you. Okay, so they advocate the health and social welfare of patients, monitor patients' health and social record signs, administer medications and treatment. Yes, they are trained to administer medications. Okay, they also perform diagnostic tests. Of course, they are able to perform diagnostic tests. Diagnostic tests may fall under scans. You know, sometimes when you have certain things within your body, and or they need to have diagnosed a proper check. So that is when they put what we call ECG. ECG is the kind, those are things that they put on your chest and your body. They put it around your body, able to read your heart rate and read internal stuff. So nurses are able to, but not nurses alone. Even their support workers who have been trained to be able to do that. Okay, they educate patients about the management of their illness, and they provide support and advice to patients. Okay. Now, do we have any questions at this stage? Do you have any questions?
No.
No questions at all. Okay, let's give ourselves 2-3 minutes or so, then we can continue.
I just want to ask one thing. If you are not trained to do like observation, but you know how to do it because you have been there for long, and a nurse asks you to do it, do you have a right to do it?
If you not within your right to do, if only your job role identifies you to be doing those, okay?
Yeah.
If your job role does not, yeah. So you need to have been cleared by your nurse or the clinical team or your line manager that you are being cleared to be doing that. You might know how to do it, but then if your job role does not require you to be doing that, then you have to get clearance. Okay.
Yeah, because I work in the hospital, and most of the time, when the nurse, because they are very busy on their job. So when we are free, because I'm a support worker, they always ask us to do it. Sometimes we do it because we know we have been there for long. We know how to do it.
That's
But
fine.
sometimes I'm just feel like if something goes wrong, maybe they will come to me because actually I'm not really trained to do it, and it's not my job to do that. But when you say no to them, it become like
you cannot say no to them, of course.
yeah, because there are sometimes if you say no, they become angry. Sometimes some of them they will say you are not helping, and they just find a way to like to report you. So I don't know what to do at that time.
What band are you on?
I'm still on band 2. I'm not yet band 3. I'm still on band 2. I'm a support worker.
Yes, I know you're a support worker. You've said that several times. But
Yeah.
if you're on band 2, yes. Once a nurse tells you to do observations and you know how to do it, there's nothing wrong you doing it. At the end of the day, you were instructed, it wasn't your own. You didn't just do it.
Okay.
You were instructed by a nurse, and therefore you have some clearance, okay?
Okay.
Yes, and it also depends on your job role. If that's your job role, employment, what does your job role state that you're meant to be doing observations and all that?
No, we don't supposed to do.
Exactly. So it's just there are some things that we call in law implied duties.
Yeah.
Okay. They may not necessarily be stated in your employment law. However, it helps you as well, okay? Because you know how the healthcare industry is a funny industry. The nurses, if they are not happy about you, they talk about you. You understand?
Yeah.
They gossip and say things about you, which will not be good for. They can even frame things against you. So you just don't want to fall out with people, would you?
Yeah.
You don't want to fall out with people. And so if a nurse instructs you and you know you can do it, and you go ahead and do it. You understand me?
Okay.
Exactly. Yeah. But because you don't want to create an environment that they will be complaining, that when they give you.
Yeah, most of the time that's what we do because we don't want to have any problem with them. So we just do it and let go start. So
Exactly.
anyway, thank you.
All right. Any other
Yes,
questions,
please.
please?
I just want to ask another question concerning what the lady said. What if something happens and there's an investigation, and maybe, because some people are funny though, maybe when there is an issue, that nurse can easily say, maybe deny or whatever. What's going to be your position? Because you are not trained to do it in the first place, and it's not on your duty.
So can we be specific? Which of the rules that is it still on observations or is it on something else?
Yes, please. It's the observation, or generally anything else, because something that is not under your duty, you doing it is like you're taking risk.
Yes, and so if you listen to me carefully, I mentioned, I don't know whether you have joined by the time when I was giving those explanations. I did say that when you come to healthcare professionals, you don't really have a regulatory body that regulates you per se as compared to nurses and doctors and other professionals. However, to protect yourself, you need to be part of a union. Okay? Were you part of when I was explaining this?
Okay.
Were you on the group? You need to be part of a union because it is only the union that will protect you. Okay? All right.
Yeah. Okay.
So you need to be part of it. It's mandatory that you join a union, whether you are part of Unison or Royal College of Nursing, you need to be part of one of the unions. So that when there are any other issue that, again, the union would then fight for you. You understand me?
Yes, please. Yeah.
Yes. So you need to be part of a union. Some hospitals have unions within. There's so many unions within. Okay, or you can join your private union, which you can join Unison and all that. And then they will definitely, if indeed you are not meant to perform a role, and then you have done the role and there are any issues, and you can explain yourself that you were instructed. For observations, I don't really think you may necessarily have issues if you know your job very well, unless you don't know what you are doing, or unless you know really, because to be able to do pulse rates and temperature rates and all that. But I feel the specialized areas like ECG. Okay, does any of you do ECG?
No.
Does any of you do ECG?
No, I can't do it.
Okay, all right.
Although I know how to do it, but I always say no because
You
I
always say
don't
no.
want to. I don't want to get
So
involved in
like
any.
ECGs and all
Yeah.
that. So for me, what I recommend is that you can have a word with your ward manager or whoever and say, you want to be trained because you've been supporting the nursing team every now and then, but because you have not really undergone a proper training with the ward, so you want to be put you under a training and all that, so that you know that you are being cleared. Do you understand what I'm saying?
Yeah.
Yes,
So you can have
Yeah.
some word with your ward manager or whoever is the top manager within the clinical team. Okay, but you don't need to do things that you have not been trained or you have not been cleared. You need to be cleared. The word is clearance. You need to be cleared by somebody observing you in what you are meant to have done. And so but then to safeguard yourself, you need to be part of a union. Okay, so that when there are any report or something made against you, there should be a union to be able to sort of protect you. Are we together?
Yes, please.
Yeah.
Thank you so much. Thanks.
Any further question? Has the question been answered properly for you?
Yes.
No, what
please.
I just want to add that sometimes when they ask me to do the offs, what I do is that when I do the offs, I don't directly put it in the system. I prefer to give it to the nurse
You write
for
it
her
for
to
them.
put it.
Okay.
So I hand it over to her for her to do it when I finish to do the offs. That's what I do. I usually do. So just for my own safety.
That's fine. Well,
Yeah.
normally if you do certain observations and the nurse
Yeah.
feels that they are not
Yeah.
properly done, they will normally do it again themselves,
Yeah.
or they'll ask you to do it, because you can tell when you see a pulse rate and it raises concerns.
Yeah.
Pulse rate is very high, and nurse can tell. Okay.
Yeah.
The nurse can tell, exactly. So they might need to do it again or probably ask you. So the most important thing is that you need to know what you are doing. That's
Yeah.
key. You need to know
Okay.
what you are doing. But then you need to be part of a union as well, because
Oh,
there's so
okay.
many allegations within the healthcare industry. Okay. So many.
Okay.
And therefore, if you're part of a union, and the union, you are able to explain to the union your situations, when they are issued, they are able to protect you. Okay.
Okay.
Yes. All right. And for in terms of other duties, yes, it is good that you can ask for you to be trained, because it helps you to become a band 3 and also progress within your healthcare profession. And so if you feel like you are very confident in what you do and you love the job and you want to learn more, you can speak to your ward manager or the senior and say, listen, I've been doing this for many years supporting, but I want to be put into proper training to be able to do ECG, to be able to do this, to be able to take blood samples. And if they feel you are very competent and supportive within the nursing team, yes, they can recommend you to be going put under those training if you're a permanent worker and not an agency worker. Okay. The rest of the people, do you have any questions at all? We are 16 number.
No questions, sir.
Okay, so let's crack on then. Let's crack on. So specialist, we spoken about consultant, but specialists, we can say radiotherapies, kidney dialysis and all that, or surgeons, those who do surgery, and these are specialized within the health and social care. So specialized services are not available in a local hospital because they have to be delivered by the specialized teams of doctors, nurses, and other health professionals who have the necessary skills and experience. Unlike most healthcare, which is planned and arranged locally, specialized services are planned nationally or regionally by the NHS England, which is true. So sometimes you realize that there are some referrals that doctors or GPs will do, and you have to travel far from your home because those particular specialized profession are not found within your GPs or your locality. For instance, if you live in Manchester, you might be meant to travel to Salford to a particular place for a specialized treatment and all that. So they are certain, like kidney dialysis, radiotherapy, chemotherapy, some of these things, those who have cancer, and the specialized areas that they need to do. So these are the areas that the lecture seeks to address. You see, now let's talk about the healthcare worker. Most of you are healthcarers already, I think. So you know the roles. You help patients to move around, monitor patients and performing basic healthcare checks, make patients feel comfortable, washes and dresses patients, serve meals, and help to feed patients. Very, very key. Okay. Now, how many of you have been trained to do catheter?
I've been trained.
Yeah. And so this is just a few things that the healthcares do. It's not more detailed. Healthcares do a bit more than what is being stated here. Okay, guys, they do a bit more. So if you work in an hospital setup, you realize that healthcare who, if you really want to get experience in healthcare, one of the best places you have to work with is within the hospital, okay? Because in the care homes, you might necessarily not be doing all these catheter things and all that. Most times, you may have only few clients that may have, but in the hospital, you are able to do a bit more. In the care homes, you might not be doing observations and all that. Most time the nurses are the ones who do them. But if you work in the hospital, you are able to get a bit more broader experience. So support workers don't just do the few things that have been stated there. Some of them are able to do catheter. When we say a catheter, the bag that is being attached to
The catheter, sorry, sir. The catheter, what I know is in the care homes, we don't fix it through either the womanhood or the manhood, but you only do the extensions. Either take the bag and then you empty it, or you fix a new bag added to what the district nurse will do. So I know it's only the district nurses who fix it. Then we only add the bags, the night bags, and then you as well empty it and whatever.
that
That's
is
all
right.
that I know. Yeah,
Yes. So who is speaking now?
it's Faustina.
Faustina, that is right. It's the same thing in the hospitals as well. In the hospital, the fixing is not done by support worker. It is the same thing across in the hospitals, same as in the care home. The only persons who can fix those are nurses. So in the care home, yes, district nurses or the senior nurses that you work with. However, like you clearly stated, there are support workers who have been trained to do that. You understand me? Okay. There are support workers even within the hospital. There are support workers who have been trained. They may be band 4. I mean, how many of you have heard of band 4? Okay. They are specialized support workers beyond even band 3. Those who are able to take the blood samples. Have you seen support workers who take blood samples?
Yeah, in my hospital, they're band 3.
You
They
have
can
them.
do
Exactly.
Yeah,
Exactly.
band 3 can do blood. They can do catheter.
Exactly. Exactly. So, Faustina, do you understand now? Faustina, are you there? Faustina, are you there? Faustina, can you hear me?
Yes, I can hear you perfectly well.
Yeah,
I've
so I'm saying
understood
that
you.
in the
Yes, I've
hospitals,
understood.
unlike the care homes that you become limited, there are so many things that carers may not do. In the hospitals, there are carers who are band 3, band 4, who have been trained and they're able to do catheter fitting. Do you understand me now? Okay. And so your colleague have just confirmed that. Okay. So yeah, generally or primarily, care support workers are not able to fit, they are not trying to fit the catheter before the bag is fitted. Yes, it's done by the nurses or duty nurses, whether in the care home or in the hospital. But in the hospitals, there are senior support workers that have been trained to be able to do take blood samples and able to do this catheter fitting and all that. They are trained. The only thing they might not do is medication, but they can do a lot of the things that nurses will do. Okay, and so support workers do a bit more. Okay, a bit more. You're changing of the 9 bag catheter bag, and fitting new one. I mean, and then recording them when you have them, because when you change the bag, you need to read the date at which the bag was changed. So there are records showing all those. So support workers do a bit more, and that is why it is easier for a support worker who have gained the necessary skills and to progress on to becoming a nurse. And so if you check out the nursing interviews and as a support worker, especially going through the nursing route as a mature student, either with your functional skills, maths and English, and your level 3 qualification, health and social care, the two of them enables you, and with your experience, it enables you to become a nurse. Okay, because the interviewing board look at the experience that you have gathered, those experiences, and they realize that no, you have all those experiences, so they easily take you on to become either an adult nurse or in that a mental health nurse, or you decide to be a learning disability nurse. Are we okay? Are we okay? Any questions at all? Okay, so social workers, we've explained that they work hand in hand with families and their duties to ensure that the well-being of families are on top notch. Okay, now we mentioned about regulatory, and regulation. I said regulation plays a major role within the healthcare industry. There are various regulatory bodies that protect public from a number of health risks and provide numerous programs for public health and welfare. One of those is the CQC. I've spoken about the CQC severally already, and I did mention that their primary law is to respond for registration, regulation, and inspection or renting. And I did mention that normally you realize that those of you work in hospitals or care homes, when they are going to be a CQC inspections, your managers, you see how busy you become. You have to make sure that the care home is clean and tidy, everything is in the right positions and all that. Why? Because the CQC have the right to recommend that your care home should be closed down or the hospital should be closed down. So CQC is one of the key organizations that the onus lies more of the employer rather than the employee, because it is the employer or the managers or the owner of the care home are the ones who have to ensure that the health and safety structures within the care home or within the hospital are clearly defined and looks eye-catching, and the documentations of everything are properly organized. Okay, and the various confidentialities and how data protection, GDPR, they are properly organized, computer key locks and all that. So these are things that CQC would have to look into. Okay, then we also have what we call the ACPC. The APC is the Health and Care Professional Council. They regulate The radiographies, those who do radiographies within the hospitals, they regulate physiotherapies, and all those dietitians, podiatrists, and that all those areas are handled by the speech and language therapy. So the health, and so it's not every profession that falls themselves under the NNC. If you want to become what we call occupational therapies, it falls under the ACPC. And also there's profession, there's this one more profession that anesthetics, you see, the anesthetics, those also for themselves within the Health and Social Care Healthcare Professions Council, okay, rather than the NMC. Okay, so we spoke about those health regulatories last week, okay, and I've mentioned all this, so I won't recap. The General Medical Council, the Nursing Medical Council, what they regulate nurses, and the Optician Council, we've spoken about this already. We also spoke about the social care regulators. I think we did that last week, okay? The Social Work England, SWE, the Social Care Wales regulates social workers within the Wales, the Northern Ireland Social Care Council that regulates social work. We have the social care services. We spoke about that. That is responsible for registering people within the social care in Scotland. I think we spoke about it last week. Then we have the National Institute for Health and Social Care Excellence, the NICE. It's an executive non-department public body or the Department of Health in England, which publishes guidelines for areas. So the guidelines, they are guidelines that care homes need to follow, guidelines that hospitals need to follow, and those guidelines are handled by the National Institute for Health and Social Care Excellence. You see, the use of health technologies within the health and social care services and within the NHS Wales, okay? The clinical practice guidance on appropriate treatment and care of people with specific diseases and conditions. So those who have HIV/AIDS, those who have COVID-19, and on how do you treat them? Those are guidance that they look into. If somebody has end-of-life treatment or end-of-life care, how are the guidelines in treating people with end-of-life? Okay, you can't treat them like any other person. Guidance for public health, public sector workers on health and social care and ill health avoidance. Okay, avoiding those ill health, and guidance for social care services and uses. Okay. The NIC was established in an attempt to end the so-called postcode lottery of healthcare in England and Wales, where treatments that are available are dependent on the NHS Health Authority area in which the patient happened to live, but it has since been acquired a high reputation internationally as a role model for development of clinical guidance. Okay, so at the time we had what we call postcode lottery. You normally receive letters in your postal address, and those were some of the ways where treatments were given based on that. But then the NHS NIC have really gone more nationally or more international in addressing those clinical guidance. Are we together? Then we have professional bodies like the BMA, the British Medical Association. Okay, the British Medical Association is a registered trade union for doctors in the United Kingdom. So just as we have trade unions for nurses, there are trade unions also for the Medical Council. Okay, then we have to look into what we call good practice. What then is a good practice? Most simple explanation of good practice in health and social care involves staff working in a way that puts the needs of the people they are caring for first, so that they receive dignified and thoughtful attention and have the best experience possible. Poor practice is the opposite of good practice. Of course, I mentioned about what we would say best practices, okay, or fit for practice. A nurse is a nurse because you would have to follow the best practices. A carer is a carer because you need to define best practices within your care home or within your hospitals. You are being told that when you are taking care of somebody who has certain things, you need to put on apron. If there are certain ailments or you have to deal with certain things in their body discharge and all that, you need to put in apron. That is good practice. Okay, you can be found wanting. If you go into a side room in the hospital, you have what we call side rooms that are dedicated for people with certain ailment or contagious ailment, they don't put them to the ward. They put them in a separate, segregated room. If you are going to those side rooms in the hospital or even in the care home, you need to put on an apron. You need to put on a nose mask. Why? So that you don't get yourself exposed to what? Those contagious ailments. In that result, you put it, also transfer those to your friends. And so there are best practices that support workers need to follow. You don't do things anyhow. And if somebody watches and finds you that you're not doing those things, they can report you. Okay, so there are best practices that you need to follow. Washing of hands. At any point when you move from a side room and you go, you have to wash your hands. Once inside, the side rooms may even have the sink that you can wash your hands before you come out of the place. Move your gloves and aprons. And then now the aprons that you take into a side room, you don't bring them out. Okay, if you put an apron and a nose mask that you get into a side room, you don't bring those things out because those things will be contaminated. So you move them out and put them in a bin inside the side room. You don't bring them out. If you don't do all these things properly and somebody keep watching you, monitoring you, they can. So these are what we call best practices. Okay, if your colleague is not doing things right, politely, not rudely, politely, if you have a colleague you work with and you feel that they're not doing things right, politely tell them behind and say, listen, what you are doing is not right, and you have to draw their attention as well, because over time to catch up with you. Okay, all right, so this is what we call best practices. Okay, do you have any questions at all? Do you have any questions at all? Okay, the Health and Social Care Act 2020. Hello? Do we have any questions?
No questions.
That's fine. That's fine. That's fine. So we have to then look into the Health and Social Care Act 2012. We spoke about it the last time, but we'll just briefly go into it. It is a legal duties about health and social inequalities, and what it seeks to address is to ensure that duties within the health bodies, including Department of Health, Public Health England, clinical commission groups. Clinical commission groups are groups within NHS and or within the Health and Social Care Department that seeks to look into how treatments are given within the clinical environment. Okay, the nurses, the doctors, they are the commission groups that ensures that the clinical part of health and social care are clearly done. Okay, so observations is all part of clinical duties. Taking blood sample is part of clinical duties. Okay, all those things are clinical duties that if you're not trained, you cannot do them. And the NHS England requires that the bodies to have due regard to reducing health inequalities between the people of England. The Act also brought in changes for local authorities on public health functions. Then let's look at the Equality Act 2010. We all know that when you talk about equality, it's talking about the various imbalances within the healthcare. Then you are talking about equality, talking about the 7 components that form sexuality, age, gender. Those are all things when we talk about equality we look at, okay? That there's no discriminatory within the health and social care, that you don't say that somebody is a black person, so you will not treat that person, or somebody is a white person, so you will not treat it, or somebody has an HIV, so you will not treat that person, okay? Some of those HIV information may be only related to only you, the carer, and the nurses, and it's not out there, okay? So you cannot discriminate. You cannot discriminate against somebody because it's a black or it's white, because it's a younger person, or it's because it's a transgender, or because it's a bisexual or whatever. You cannot do that. Okay. The Social Value Act 2012 requires the public sector commissioners, including the local authorities and health and social care bodies, to consider economic, social, and environmental well-being in procurement of services or contracts. Creating social value has clear connections with efforts to reduce health inequalities through actions on social media determinant of health. For example, by improving employment and housing. Very, very important. Social value, that's what they look. Where health and social care is more broad, social value tend to look into more of the local authority. The last time I explained that. More of the councils, social workers within the council, looking into homes and families, okay? Defining social value with reference to social care determinants of health can help to reduce local inequalities, improve the health and well-being of local people, and in longer term, reduce the demand on health services and other issues. Okay. And then we will bring our lecture for today to an end. Are we together? So we're able to touch base on different aspects within the health and social care. We're able to look at the range of health and social care professions. And then we were able to look into how to assess those professions which is regulated. Okay. All right. And then if you look at your model, there's so many references that you can look into. You have your career options in medicine, specialism. We have the geriatric medicine, health carers, maternity support worker, health carers, NHS England, working with the NHS in mental health, social worker, health careers. You can look into this. Duties of a doctor, the GMC website, you can look into that. BMA, British Medical Association, you can look into National Institute of Health and Social Care, Wikipedia, you can get the, and then Health and Social Care Regulators, the acpcuk.org. Okay. Guys, we'll bring our meeting to an end. Do we have any questions at all? Have we learned something? What have we learned new? And as a carer, you need to be. The healthcare profession is not easy as we say it. I must be honest with you. Until there's a problem, then you realize that you are not your own. Okay, because that can, just because you're a support worker, it could mess up your entire DBS. And we have lots of reports. You know, as a lecturer, I don't do lecture. I'm also an expert within the health and social care and the legality. And so people call on me to advise them when they have issues in their workplaces, and I always advise them. And every now and then, especially within the African community, one of the major things that I tend to return, the reports that we tend to hear is sleeping on duty. Okay, within the African community and other against so many support workers, is sleeping on duty is one of the major things that is raised about. So my advice is that don't overdo, don't take so many shit because of money. Okay, don't overwork yourself because of money. Don't do night and go and do day the next day without no rest. Don't take so many shifts within the week, because at the end of the day, it will affect your health. It will affect your body system. And there you realize that you'll be sleeping on duty. And it's not everyone who will get you sleep. Some of them will even take pictures of you that you are not even aware. And they will report you. And that can mess up your entire healthcare. You cannot become a nurse, because once you are reported to DBS and DBS decide to ban you, your chance of becoming a nurse is less. So don't overdo yourself. Money is good, but then make sure that you don't overwork yourself. Make sure that you work within your strength and you don't overdo things that will affect your working pattern or who you are. Okay. You know, so those are the few things. Those of you who are not part of a union, try to join a union. Very, very, very important. Trying to join a union is very, very key in doing that. Okay. Read. There are programs, there are trainings that within your hospital and your care home you can be put on. Ask questions. They can put you on different training. You can be trained on different, even internally, they can put you on program, level 3 program, level 2 programs within your organization sometimes as well. Okay. And that would help you. Sometimes you are open that they are able to train you to become a nursing assistant or even train you to becoming a nurse. They have made you various modalities within care homes or hospitals that they have available that can put you into programs that will even help you to become a nurse. All right. So these are the few things I'll say. Do we have any questions at all?
Thank you very much.
Guys, do you have any questions?
No question. Thank you. Your class was very
No
interesting.
question.
No,
Thank
thank you
No
very
questions.
much.
Are we sure?
Yes.
Mr. Daniel.
Yeah,
Thank you so much.
Please, I'll expect you guys to put your feedbacks on the message group for me, please. Okay.
Okay.
Good. All of you put your feedbacks on how the program was, how it was interesting, how the lecture was, whatever feedback you have, can you put on the message group for me, please, before you go off, please.
On
The message where you
Okay.
put your full names.
All right.
Where you put your full names, okay? You can
Okay.
add your name to it if you want there, so we know that it's coming from you. Okay.
Okay.
So our next lecture is tomorrow, isn't it?
Yeah.
Okay, I expect to see all of you. So don't leave without not putting a message. Okay, we need to get feedbacks. Okay, please. So write your name and put your message. All of you. Where is Emmanuel?
Yeah, I'm here. I'm here, sir. I just did
Okay.
now.
I didn't hear from you
Lovely
today.
class. Yeah, I was, but my network was not too good, so that's why.
Okay, that's wonderful. And then
But
Damilola, were you here today?
SBB.
Damilola, were you here today? Damilola. Okay, Damilola wasn't here today. Victor, I didn't hear from you today. Victor. So
Yes, I'm here.
Today you didn't speak at all.
Yeah, I joined very late. Sorry.
Okay.
Yeah.
You guys should put your feedbacks for me, okay? And Faustina spoke today, isn't it? Madam Faustina Dazi.
Yes, I did.
Okay, please kindly leave your feedbacks on the message tab for me, okay? And if you guys have any issues, you can put them on the WhatsApp group, but I need your feedbacks in there. I have 2 iPhones.
Oh.
Say it again. Sabina,
Yes, please.
could you leave your feedbacks for me? Were you paying attention at all?
Yeah, I did it already. I've done it.
Amazing. Temitopa Esther, are you on? You didn't speak at all. Noel.
Yeah.
Temitopa.
Did you call Noel?
Yeah.
Yes, I call. Are you Noel?
Yeah, I'm Noel. I just put my message and
Okay, but we didn't. I want an interactive class, okay?
I was the one talking. I was the Bantu one that was talking all the time.
Okay, I didn't know. So next time mention your name so I know who was speaking, okay?
My name is Noel. Sorry.
Okay, that's fine. An interactive class. So I need you guys to be talking to me, okay?
Okay.
Interactive. Those who have experiences be talking so that those who don't have can also gain experience, okay?
Okay.
All right, guys, put the message there. And so we'll meet tomorrow, okay?
Thank you, Mr. Daniel.
You're
Bye.
welcome.
Thank you.
Okay, thank you.
You're welcome.
Thank
You're welcome.
you.
Bye.
Bye.